Here's how simple and easy it is to use. Take your aligner, determine the position that you want to place your auxiliary. For demonstration purposes, I've used a metal button. Place the material, the bond aligner, on the back of the button. Position it on the aligner. If you like, then you can remove excess and cure. And if you like, you can test the strength of your bond with an elastic before you deliver it to the patient. There are a few technique tips and hints that I've learned over the years. I'd like to share those with you. One, you can take a fine tip Sharpie and place a mark on the aligner where you'd like your staff to bond the auxiliary. That way you make sure you get your vector of forces set up just like you would like them to be. Two, it's not bad to leave a little flash. So when I recommend removing a little excess, leaving a little bit around the rigid pad of your auxiliary is a good idea. It increases the bond strength. When you do get bond failures, the bond failure is between the rigid pad of your auxiliary and the bond aligner, not between the bond aligner and the overlay, the matrix that you've got. So by having a little bit of excess over, it does help with the bond strength. If you do get bond failure and you have bond aligner left on your aligner, you need to get in with a handpiece to remove that because it's a pretty strong bond. My staff has actually popped the heads off of buttons before trying to remove a button that's been placed in the wrong position. Then, if you want to facilitate root movement, I use the Tomas bondable hooks. These are designed, there's a left and a right version, to be bonded to teeth and to aligners. They come in different lengths. I just shorten them depending on, again, the vector of force I desire and tissue comfort for patients. So the Tomas bondable hooks are available. You need to show your staff, again, where to place them. Bond them on. They bond just like your other auxiliaries, metal or ceramic or plastic. And the last thing I use that's a huge auxiliary when working with bond aligner and tooth movement are TADs. I frequently place TADs in order to maintain aligner adaptation and facilitate movement in segments or individual teeth that I couldn't otherwise achieve with aligners alone. An important point to remember is that bond aligner was developed to adhere to clear thermoforming materials. It's not recommended for use with cloudy thermoforming plastics.